for chiropractors and other clinicians seeing patients with dizziness, with balance issues, with vertigo, post-concussion, post-MBA, any case that needs objective data and further extensive assessments of the neck, we're here for you.
Hey everybody, you are live in studio right now, and I'm happy to have Orri from NeckCare in the house, quite literally. And he brought over one product that I spoke of a few weeks ago on the podcast, and it really got my attention, not only because of the design, but also because of the ease of use and the extent of the information that can be gleaned from the NeckCare unit. So you brought out the box. I'd love for you to do a little unboxing right now as well, because as we've discussed, I love great design, and not only is the design great in terms of its user functionality, but even the packaging. So, for docs that might not have tuned in earlier, as you unbox that, talk a little bit about what the NeckCare device is and how it helps practicing docs.
Yeah, no, absolutely, Jeff. Great to be here. Some people talk about the Apple look and feel. Definitely a compliment.
Right.
So, yes, we open it up here. We have the NeckCare device. This is the hardware device and goes on the patient's head. You will do the honors later,
yes,
when we go through the assessment. But what it does is objective assessments of the cervical spine.
Got it.
So anything from range of motion, proprioception in the neck, and sensory motor integration.
Got it.
For chiropractors and other clinicians seeing patients with dizziness, with balance issues, with vertigo, post-concussion, post-MBA, any case that needs objective data,
right?
Further extensive assessments of the neck, we're here for you.
One of the things that I really like is, and we've discussed it, is there's so many docs out there that are just doing, they're using goniometers, which might be, in my opinion, a dated technology. They might also be just using kind of an eyeball test, which is just so subjective as opposed to objective. And some of the reasons why, in my opinion, is dated infrastructure, right? Tools that the goniometers are just like a pain in the butt to use. You got wires everywhere. It's just uncomfortable to use in a patient setting. Yep. And the other aspect is just not having something that's giving the data the doctor wants. In other words, can I cleanly and easily do the test, obtain the data, process the data, and make a clinical decision without having to become a PhD to be able to figure it all out? So one of the things, and as you kind of pick this up, and I will right now as well, is this is such super lightweight. It's flexible, so you really are able to fit it nearly instantaneously to most people most of the time, where they're able to slide it on, and then you can just get after it, as opposed to feeling like you're in this quagmire of technology. I know we all love the results that technology can provide for us, but when it becomes a hindrance to being able to get the test, that's a real pain in the butt, and quite often it makes us shy away from things. So talk a little bit about the design of the unit. I know this has gone through an evolution as time has gone on as well. So talk a little bit about the design and why the design in terms of the flexibility and in terms of being able to have good ease of use is important.
Yeah, no, absolutely. So what we are going for, and from a design perspective, is obviously it has to work. The number 1, 2, and 10, and just effing works, like we say internally, right? You don't have to think; it should just be intuitive and work in a couple of minutes. So we know time is so limited in a busy office, no matter who you talk to. So you have to be able to rely on the technology, and it has to work and be quick and efficient. And then as for the design, obviously as well, it has to. We've done extensive tests on this as well from an FDA perspective. So we have that covered, but also we have like this, BOA system, pretty neat. So, we haven't had a patient that this hasn't fitted yet. So, but super easy, intuitive, and that's what we're going for.
I love that. And talk a little bit about, if docs out there visit, and we'll drop the links down below, please visit the website and connect with the team. But you really take education seriously, whether it's partnerships with institutions, whether it's with technique and learning institutions. Talk a little bit about how research and how real implementation at an educational level informs back to being able to make it good for just an individual practicing doc?
Yeah. So, I mean, research is, the core of what we do. So we really like to be on the forefront there. But what our, customers and clinics and clinicians are also asking for is, hey, educate me. Like, I want to learn more. What does proprioception in the neck even mean? And how can that help in my clinical decision making? And also that ortho and neuro world, in my experience, those have been two very different schools and professions. If there's a neuro case like a concussion, the typical orthopedic chiropractor or professional just pushes that out, refers that out. What we've been able to see is actually people don't have to refer out as much because, hey, they are now getting comfortable and in looking at those cases. And the same for the neuro people. Hey, I can actually look at the neck because the neck is involved in so many of those cases. The cervicogenic dizziness, cervicogenic headaches. You can't actually suffer a concussion without having a neck-related trauma as well.
Right. And let's dive a little bit deeper on that, specifically related to the docs out there. Whether you are 100% personal injury, MVA, or maybe it's just a portion of what you do, but it's an important component. Mm-hmm. We always make the jokes. We'll ask a doc, what percentage of your practice is personal injury? Mm-hmm. And if they say 20%, we say, it's 80% of your revenue. Yeah, 20% of the volume might be 80% of the revenue. Yeah. So it can be a small, even in practices that aren't MVA specific, mm-hmm. it can be an important part of their ability to earn income. And we all know that tying objective proof of injury and objective data is so critically important when you're putting together that narrative at the end of the case. Yep. Talk a little bit about how NeckCare, how the data that this produces really can make an impact in a case.
Yeah, so I think everything from that initial assessment, but also to tracking progress. So, to continue to get that authorization as well, or for prolonged treatment, you have to be able to document, okay, why is that additional treatment needed? Right. Well, you show that on the data. So to be able to objectively document that, and with, the butterfly test as an example, the signature of the neck that we'll go into later, it's not just range of motion. It's actually looking at the, how the eyes, the neck, and the head are actually, working together. So I think from that perspective, anyone, a patient, an insurance company, or a lawyer can actually look at that data and say, okay, this is off, or this is in the right direction, or in the wrong direction.
Right. And when you look at reporting within the software, we're going to do a deep dive in a few minutes, but maybe highlight a few of those key reports that are or can be generated.
Yeah. So range of motion reports in under 2 minutes. Proprioception, so joint position error. Tests, for, probably remember it from school, but, was taught with a laser, head-mounted laser. The patient closes their eyes and they try to find their neutral position. And then the butterfly report as well, the sensory motor integration, that eye, head, neck coordination.
Got it. And talk a little bit about that butterfly report. Many docs listening and watching might be familiar with the range of motion of the proprioception, but the butterfly might be new to them. Yeah. So maybe first define sensory motor integration as you see it. And I'll ask you secondly to point out, how does the butterfly test showcase that? And why is it important?
Yeah, it's common to just look at things in a silo. Like look at eye movement, for example, just on its own. Well, the neck and the eyes are actually very connected. And there are muscles in the neck here that are directly tied into ocular motor and the vision. So you cannot just ignore the whole system and just look at things isolated. Like just look at the neck or just the eyes or brain activity as well, like from a cognitive perspective. So to be able to perform the butterfly test, you really have to and perform well on it. All these systems have to work, and they have to work well together.
Yeah, that makes a lot of sense. Let's dive in.
Yeah,
let's take a look at some of the software. Let's take a look at some of the reporting, and also I'll do a few tests.
Yeah, no, absolutely. So let's put this on. So you can do the honors.
Okay,
just gonna turn this on. Yeah,
mm-hmm. Good to go.
Yeah, put it on, and then you can tighten it. Yep. just like a snowboarding.
There you go. There you go. Okay, great.
Okay, it feels nice.
Yeah. Is that a good position?
Yeah, absolutely. You could be a NeckCare model. So what we have here is a web-based platform. Okay. So accessible from anywhere as long as you have internet connection.
Love that.
And super portable as well. What we've actually seen, I mean, just, yesterday we got news from one of our customers up in New Jersey. They went out to a college and did a baseline assessment of all the athletes.
Right.
So baseline concussion assessments for the whole team, being able to generate additional revenue.
That's awesome.
And new patients as well. So once someone suffers a concussion or contact, who are they going to go to?
Right. The doctor that made those baselines. And I want to point out, I just want to highlight as you dive in here for everybody listening and watching exactly what you just said. This is ridiculously portable. I mean, we're talking about a device that probably weighs an ounce or two.
44 grams. There you go.
And then a laptop, a tablet that the doc is already going to have with them, and being able to get out. I see one of the biggest areas of growth, and everybody that's followed me knows I talk about how many young docs fancy themselves as sports chiropractors.
Yes.
So being able to have another really technology-driven, yet foundationally data-backed way to do objective assessments with and around sports teams in your community is a massive opportunity to be able to get your name known, to be able to have a little bit of an advantage as other docs may be competing for that attention with those teams, but also be able to provide a ridiculously high value service that doesn't require you as a doc to have to bring a ton of gear. I mean, you literally bring a piece of equipment that weighs 44 ounces or 44 grams, excuse me, and the laptop or tablet you're going to have with you anyway, and you can provide, we're going to look at in a moment, a variety of tests in short succession that can be really, really meaningful for those athletes long term and are super meaningful for you as a practitioner if they decide to come in to see you in the future. You have baselines pre-injury or pre-whatever that reason is. That's a massive value add. So I hate to take you off topic.
No.
But I love the opportunity to be able to connect and engage on the sideline, in the locker room, wherever it might be with these teams in a simple, easy, and fast fashion. Cannot be overstated.
No, absolutely. And there's another element there, is the relationship with parents, for those student athletes.
Yep.
So to be able to have a documentation that, hey, there's actually something wrong.
Right.
It's not, the overly eager dad, like, hey, there's nothing wrong with him, let's put him back in the field. And to be able to show the dad or the parent, hey, do you really think that this looks right?
Right. All right, so this is the portal. So you have patient information on the front page, easy, clean. The other thing I love is the design, not only of the hardware component, but the software as well. Super clean, super easy to see what's going on, which is so valuable in a busy practice, being able to use the system, as you said. So take it away.
Yeah, so we have assessments and exercises. We'll start a new assessment here. We have different assessments, pain scale, it's a subjective rating to know, okay, what's your neck pain today? But then we have range of motion, joint positioner for the proprioception, and the butterfly test for the sensory motor integration. Okay. Let's start with the range of motion. Everyone does range of motion measurements, measurements. But, that eyeball test is obviously the, most widely used, the goniometer. It's still being used, but let's see how you do here in a very objective way.
Oh boy.
So the only thing you need to do is sit still, relax in neutral position. You ready?
I am.
Okay. So we will start you with flexion. So chin to your chest. Right? And then come back to neutral and then extension. Look up to the ceiling. Yep. And then track down. And then up to extension. Perfect. So you may now relax. So how did that feel?
Good. I mean, it's rare that I push to the end point, so it's interesting. I'll be interested to see the data because it's very. I'm like, oh boy, I probably never look up that far. So it's like that. It's interesting. I'm excited to see.
For sure. So now we do rotation.
Sure.
So the only thing that you need to do now is turn left. Yep, and then right. and then left, and then right. That was that.
Awesome.
And then last but not least, the lateral flexion. So in a neutral position, and lateral flexion left, lateral flexion right.
Hello, rotation.
Yeah. Flexion. And we will see that.
Yeah, I know.
So that was that.
All right, easy.
Yep. And now, even though you love documenting things manually, we do it for you. Here we will actually see your results.
Okay.
So let's zoom out just a bit here. So we also then compare it to normative data.
Got it.
So tell me what you see.
Okay. So it looks like my flexion is within the normal range of motion, which is great at 53.7 degrees. My extension a little bit less, just one standard deviation or less out of norm, so just a couple degrees up.
Yeah.
My left rotation looks good and within normative data. My right rotation is cooking. We're doing really good. I'm at the top end there. And then my lateral flexion is just about within normal. Lateral right is more normal than lateral left, but lateral left is just off.
Yeah.
How's my interpretation?
No, great. And the only thing that I would probably point out here is that your right rotation is doing fantastic. You're actually pushing towards hypermobility.
Interesting.
And that's another data point that a lot of people are so happy to have here. And that wouldn't be visible with the naked eye.
Right.
And so the discrepancy here between your left and right rotation might actually be something we want to look at. And something, a manipulation, for example, might be needed.
Yeah, and I want to just point out, as you kind of put me on the spot to read that, I'd never really read a report so it tells how intuitive the report is, that I can literally go through it that quickly and be able to identify two things that I want to point out for everybody as we bring this up on the screen is, one, you're going to get the degrees to 1/10 of a degree, which is awesome. There's a lot of specificity there. And it's objective specificity. The second component is what I was looking at, cheating a little bit, not knowing the numbers off the top of my head, is that the graphical representation of what I'm going to say is your red zone, your orange zone, and your green zone, red being clearly dysfunctional, yellow being close to normative, and green being within the normative data set. That was a massive help for me because I'm not somebody who particularly thinks about these numbers day in and day out. So being able to have a visual cue on what's normal, also, pretty much everybody knows red, yellow, green. So even from a lay perspective, if they don't know, your patient, as you're discussing this, doesn't know the exact degrees, they don't need to be able to know, okay, great, where am I doing great, and where do I have areas of improvement? So
that's awesome. Great. Yeah, and you're spot on there also from a patient perspective, they will not understand 53.7 good or bad.
Right.
They will know that, hey, green is good.
That's right.
And for the clinician, we also have additional data here. And you alluded to it there. When you did lateral flexion left, there was some rotation or some flexion extension actually going on. So you had 33.7 degrees in the lateral flexion left. However, you also had an 8.4 degrees in the rotational plane and 12 degrees in the sagittal plane. So you were not doing this; you were actually doing this. If you can,
I was really cheating.
Yeah, you were compensating.
Yep.
And that's also something that a clinician would definitely take a look at.
Yeah, that's really interesting. I'm going to say specifically from a chiropractic perspective. And I'm not a chiropractic technique expert, but when I think about lines of drive, and when I think about when you're getting in there to deliver an adjustment. And not only knowing, okay, many people will eyeball it, okay, they're a little restricted to the right, but being able to have the specificity of, okay, they're restricted to the right, but they're also compensating in the sagittal plane, they're compensating with some rotation as well. To me, I think about that from a technique perspective and say, okay, that can actually impact how I deliver the adjustment and the line of drive based upon where I know either the restriction or compensations are happening, or where I know that there's a little bit, as we saw, with some of the rotation, maybe a borderline hypermobility.
Yeah, exactly.
And now I'm able to increase, I always feel like when you increase the specificity of the adjustment that you deliver, you give yourself the opportunity to at least improve the result of that adjustment. So I love that because that's a data point. I can say I have literally never seen before
Nope.
is, okay, great. When I'm doing a range of motion test, I'm used to seeing the data for that plane, but never the compensatory data for the additional planes. That's awesome.
Yeah, we hear that a lot. And like you said as well, like after, adjustment, you might actually go slightly down here in the right rotation, but you might be isolating the movement way better.
Right.
So you're becoming healthier, with a better posture, but you'll be able to see that black and white on the data.
That's awesome.
So any questions on the range of motion report?
So if I have this, what do I do with it from here? So is this something where I can easily print it out? Can I make a PDF and attach to a chart? What are my options?
Yeah, so normally, we have both the print and the download functionality right here. So normally what people do is they download it and, upload it into the patient's file in the EMR system.
Right.
So, if that's, it doesn't matter what EMR system you're like.
Great. Love it.
And then print it out and for the patient to take home with them. They feel added value. And then also just to be able to explain here, the patient doesn't have to explain, they understand everything.
Right.
But, hey, this is my justification of your treatment and why you need to do this and this and this. It's right here.
That's a really great point. I think about this in terms of the impact it can have in a report of findings, whether your report of findings is a digital packet, whether it's a physical packet, whatever case it might be. Being able to highlight, again, I think this is a challenge that many chiropractors out there have, and it's a challenge that I've had in the past as well. How do I deliver my message simply? Yeah. Right? Where there's enough there that a patient can understand what we're doing and why they're here, aside from just the pain, but that also it's not overly complex where now it just becomes, that's a hindrance, right? So I always think about how do you get to, and I think you've done a great job with the recording here, simplicity on the other side of complexity. This is obviously doing a lot in real time, and with very good specificity, and being able to communicate that in a simple to digest chart is really impactful, because to your point, that's something that is not only great from a clinical perspective, technique choice, etc., but it also gives you an opportunity from a patient education perspective to highlight things in a way that can resonate with people. Oh, I'm orange here, I'm red here. That tells me that there's a problem, and it's not, made up. It's literally specific to a tenth of a degree in terms of where they were at that moment in time.
Exactly.
And then you're able to show, knock on wood, that positive progression over time as well, which again further reinforces the healthcare buying decision, right? When somebody's like, cool, I made a great decision. Not only do I feel better, which is important, but I'm functioning.
Yes.
So I love it.
And because we all live in the world of insurance, that's also not to be forgotten that to be able to have documentation that you can also attach to a case file and in an NDA kits, right? Or when you submit your CPT codes, you attach that report as well. Just you have the documentation objectively. Yep. It wasn't just something that you eyeballed and came up with.
Yep. So let's talk a little bit about how range of motion proprioceptive testing plays a role with insurance reimbursement, and where you've seen this help doctors be able to get paid for their overall services, but also is there a CPT code for this, or how does that work?
There is. So, the CPT code typically being used is a 97750. Okay. Physical performance test with a written report. Okay. So it's an underused code. Okay. So it's a new code to a lot of clinics that has been a great addition. Yep. And then you have 97112. Okay. Neuromuscular re-education, and 97110 when you use the system as an exercise. Okay. All right.
And let's talk about that a little bit. So when you describe the diagnostic versus the therapeutic, so to speak, right? The exercise versus the testing itself. I know this from the strength and conditioning world. Often the test is then, is then the exercise. So how does that play out typically in a provider's office that you've seen? Is this part of a daily treatment plan? Is this something that's done only on evaluations and reevaluations? How does that work?
Yeah, I mean, it obviously depends on the workflow. However, where we've seen people being able to generate additional revenue is when they incorporate it into their treatment plan.
Got it.
So you come for the initial assessment, then you come in for an adjustment, and then after the adjustment, hey, you go over here to the NeckCare station, you do some exercises, and the line of sight oversight, obviously.
Yep.
And that way you can generate additional revenue while the patient is doing those exercises.
That's awesome. And could I be doing these exercises while doing other therapeutic exercises as well?
Mm-hmm.
Beautiful.
Yeah,
Great.
absolutely.
So let's take a look at what's next here in the software.
Proprioception, that's do the joint positioner. And further, once, familiar with the laser, the head-mounted laser, it's a hassle to set up. Again, it's not very objective. You have a printout on the wall. You have to mark that, then you have to calculate the degrees. So the people that are used to that know the pains and know the difficulties in using that. What we have done is exactly like the range of motion assessment that we went through.
Okay.
It's straightforward. So the only thing you need to do right now is be neutral, close your eyes. And then if you go again, flexion, chin to your chest, and then come up to your neutral position. And then I mark that with the space bar.
Okay.
And then I will reposition you like that. If you go down again, flexion, and then come back to neutral position. Right? And then I will reposition you to your neutral, and then go down, and then up to neutral position. So here we are actually looking at how well are you able to find your neutral.
Okay.
So, and for anyone that has had a whiplash or a blow to the head, or is suffering dizziness and vertigo, it's super important to look at this because it could actually be a cause for those symptoms.
Right. Yeah. I think about this in terms of also like fear avoidance behavior. If somebody comes in with neck pain and they're just so fearful about moving, and being able to establish, wherever they're at, right? They might have some work to do, but being able to establish, okay, you can move through a range of motion and get back to that, that centeredness, that neutral position, or, hey, here's a little bit of an opportunity to improve. That is also something I could see having that conversation with the patient that's really fearful about, about moving, and being able to guide them through a proprioceptive exercise, and then be able to showcase, again, as time goes on, that improvement, but also being able to showcase even just the baseline of, okay, you can do this, right? And that's a diagnostic tool that leads into the therapeutic aspect, right? Where it's like, okay, I can accomplish this task. It's not perfect, but I have the opportunity to improve. So
absolutely, yeah, great point. And then we do this for the other, directions as well. We do extension and then left and right rotation. And that might also be an indicator. Okay, I'm completely off in my right rotation. Hey, and often that's actually correlated where you hit your head.
Got it.
So yeah, you ready for the next round?
Sure.
So close your eyes, relax, and then now we do extension. So up, and then come back to neutral. So actually more off here. So yep, again, extension. Okay. Play with doctor here. There we go. Good job. And as people might have seen as well, you can actually see when they're performing the test, are you leaning towards one or the other direction?
Interesting.
So that gives an indication of how are you actually moving? Are you moving straight, or are you moving predominantly in one side?
Like I was.
Yeah. So now we do left rotation. So if you go to the left and come back to neutral. Yeah, definitely something off here. There we go. Left. And back to neutral. Interesting. Let me come to the other side here. So this would be the typical move your bro, and then left. Perfect. And then, find your neutral position. And then last but not least, right. There we go.
All right.
So how did this feel?
Interesting. Yeah. I feel like I would have guessed that I was doing better until I started.
Yeah. So, but now again, we do get the objective data right away.
Love that.
So this is how, and this is a heavily researched test as well, called the joint position error test.
Okay.
And here we can see how well do you actually hit that bullseye.
Right.
You were good in the flexion.
Right.
When we started the extension and left rotation, you actually had a tendency to overshoot. So you went too far down.
Interesting.
When coming back.
Yep.
So actually, I was looking at you, and you actually, this is where you started. You ended right here.
Interesting.
Yeah.
Yeah. Very consistent with the extension.
You are. Yeah. So consistently bad.
Yeah. This is fantastic because this enables, me, I think as a clinician, I can look at this very quickly and be able to ascertain, but I think about this from a patient perspective as well. I mean, the highly visual, I've never seen anything plotted like this before.
Yeah.
Right. Where it's just like, okay, this is super clear, super quickly in terms of like where you are overshooting, undershooting, where you're doing well, and where you have a high degree of variability.
Exactly.
So I love this. So talk a little bit about that table down below.
Yeah. So here we have the numerical data. So and also there's a difference between the visual people and then the numbers people.
Right.
So so here we have the actual degrees of error. So how far is an individual off?
Yep.
And then we also have that again in the different planes. So am I off in the primary plane, or am I off in a compensatory plane or associated plane?
Great.
And then we also do have the repetitions. So what you want to see ideally is an individual, because I'm giving you some proprioceptive input when I'm repositioning your head.
Yep.
So you want to see that trending downwards, because ideally you want to be learning,
right?
Adjusting a bit to, oh no, I overshoot here. Let me not do that again.
I didn't learn very much.
But yeah, this is the proprioceptive test.
Yeah, it's a couple of things that come to mind for me. One is the speed at which you can get this much data is something I haven't seen before. Two is, again, the ease of use, right? It's you're able to to go a few times and get very reliable data in terms of how somebody's moving. And then the third component, as you kind of illustrated, is you have the visual aspects of it as well as the hard numbers.
Yes.
So regardless of whether you're using this as a teaching tool with your patient, where the visual component might be easier, or whether it's something where you're doing objective documentation that needs to be highly specific, you have both available at a moment's notice, which is also awesome that by the time we finished the test and you walked around the table, everything's already ready. Which also that speed is just so critical when you're thinking about, okay, how do I implement something that I know is going to give me awesome data that I know I should be recording maybe a little bit more specifically than I am, but workflow issues, this eliminates that workflow issue, which is awesome.
Yeah. And, talking about workflow, I think the best cases we have seen really is where, there is, an assistant, a chiropractic assistant or aider or, a tech or even front desk.
Yep.
So it's a great way for them to be more involved, but also for the doctor to, hey, they see the patient, they already have that, we call it blood work almost. So, the doctor doesn't draw the blood work, they get the results. So to have the results on your desk before seeing a patient or at that first visit is, can be really, really valuable.
Yeah, I can see the power in that. Sure.
Awesome. So, and maybe I can show you like one of the, just case studies from, pre and post. So here's the joint positioner. This is an actual patient from one of our customers. This is what healthy looks like, how you should have been.
Right.
This is an individual that came in, they were so far off in the right rotation, they didn't even hit the red. 8 weeks into treatment, they're actually within pretty normal ranges and all.
Yeah. I think being able to show objective proof of functional improvement is so critically important, and that feels like it's always this sort of nebulous idea. I feel like as a chiropractor, it's like, okay, I know I'm going to do maybe my SFMA, my squats, my I feel like many docs do a really good job, ironically, almost outside the spine with many of those things. Whereas we look towards the spine, and being able to have functional improvement data has always been challenging. But this is, this is clear as day, and being able to show, hey, this is functional improvement. Now, hopefully the care that you're delivering, if they had pain, the pain's going down as well. But there is something to be said, irregardless of pain, in terms of functional improvement, because how we move is how we live. And if somebody's having a ton of difficulty with restricted range of motion or hypermobility, if somebody's having proprioceptive issues that are literally off the charts, that's going to impact when they go and play a sport, when they're at work, when they are doing whatever activities of daily living that they are. That's going to impact their ability to do that, and potentially even increase their likelihood of injury.
Absolutely.
So I love being able to quickly see exactly what's going on in an easy to follow yet highly specific way is absolute bullseye.
Yeah, awesome. Good to hear. Then we have the butterfly test, which is looking at that sensory motor integration. This is the only test where the patient needs to face the computer screen.
Sure.
And like you have seen here, I can essentially be, looking at the computer here for the other ones. But for this one, we need your visual system.
Sure.
So that's why we are looking at the computer. Okay, you ready?
I'm ready.
Your job here is to stay on the red dot. There will be a red dot traveling on the screen and a blue cross. You are controlling the blue cross.
Okay.
And the best way to look at it is that you are controlling it with your nose.
Okay.
So you're moving your head and neck to stay on that red dot.
Understood.
Makes sense?
Yes.
So without further ado, good.
We'll see.
Yeah. Tougher than it looks.
Yeah, it's challenging.
Yeah.
I mean, it's really challenging to be able to stay on it, even when it was slow or at times it almost stopped. It's not a movement that I'm used to considering, yet it's the foundation for everything I do.
Yeah.
That's just really interesting.
Yeah,
So,
absolutely. And the neck is such a complex area.
Right.
So there's a lot of, mechanoreceptors and proprioceptors in the neck, and all those small muscles that we're not used to training.
Yeah.
That fine motor control, that's what you're doing right now.
It's super interesting. I could almost feel myself moving in different planes, which I never think about. Honestly, you just kind of move around, right?
Yeah.
So yeah, I'm fascinated to see what it looks like.
So ready for the next one?
Sure.
And those are, different paths, traveling in, different speed and different direction. So we're really checking the holistic approach.
Okay.
Okay?
All right.
And then there's the last one.
Are they in order of speed or?
No, randomized order.
Okay. Yeah, we'll see how it goes. So it is fascinating to just even feel that motion. It's just not something that I'm used to thinking about or considering. So
Yeah.
it's really interesting.
So, and for this one, as I said, this has been over 20 years in development. And there's a lot of research papers on it as well. That's also, again, the core of what we do.
Yeah.
But what you will see here is what some call the signature of the neck.
Okay.
So now you didn't see, but you were actually tracking a predefined pattern.
Interesting.
And then we have normative data. So we can compare your results to norms.
All right. Let's see that.
Yeah. So this is easy, medium, difficult.
Okay.
So here you were moving super slowly up here.
Yep.
If this would be super jerky, that might also give an indication of your stability when moving slow.
Got it.
So you are actually, there's room for improvement. But when it was super slow, you did quite okay. When the pace actually picked up, you did worse
Got it.
compared to norms.
Got it. And so talk a little bit about what's displayed here.
Yeah, so here we're looking at the amplitude accuracy. So how far away from the dot are you? You are moving in a bit in the different directions. And then here we're looking at the over and undershoot and time on target. So how much time do you actually stay on target versus how much are you overshooting and undershooting?
Interesting.
So for you, you have, you're definitely, again, not green.
Right.
So there is some room for improvement, and you have a high undershoot, meaning that you have a difficulty in accelerating. So you have a difficulty in actually catching up to the dot.
Interesting.
For people that have a high overshoot, they have a difficulty in decelerating. They're overshooting.
Yeah.
So that might also be an indicator of what treatment approach and personalized plan the clinician would develop.
Yeah, the interesting thing, and we've discussed quite a bit about motor vehicle accidents, about mild traumatic brain injury, and that, to the best of my knowledge, I don't have either of those.
Nope.
Yeah, this is still showing that there's improvement to be had,
yes.
Which I think is really, really fascinating, because right now I'm pretty asymptomatic. I don't have any pain. I don't have any perceptible dysfunction. Yet it's not surprising to me that, hey, well, this is not something that I train for every day. It's not something that I focus on. So my point of highlighting that to everybody listening and watching is, if you have a patient coming in, even if they're not to the point of, a mild traumatic brain injury or something like a concussion, chances are, I'm going to say, if they have pain, they're probably going to have issues with this. Yep. And even those patients that are in performance mode, wellness care, that might be asymptomatic, it would be really interesting to be able to understand how they are moving throughout these planes via the butterfly test, because again, this is just one more opportunity to showcase, hey, here's where you're at today. And again, true objective functional improvement over time, which is some of the most powerful information that you can provide a patient, and that can really help them, again, live a higher quality of life down the road, is when they are moving with this. I like to always think about the balance of strength and flexibility, right? Mm-hmm. Are you able to have the strength, the flexibility, the dynamic range, so to speak, to be able to do a functional assessment and stay on point?
Absolutely.
And this is awesome, just graphical representation.
Yeah, and because you touched on the sports as well. I mean, as a professional athlete or someone that strives to be a professional athlete, you definitely want to have your sensory motor integration
critical. Yeah,
it's top notch.
Critical. Yeah, it's critical. Good luck trying to hit a golf ball, trying to hit a fastball, trying to drive a race car, in split second movements, and be able to make those decisions if you have a sensory motor integration issue.
Exactly.
It's not going to happen.
No.
You're going to be, at your best, you'll be suboptimal. Yeah. Right? So this at least gives you the opportunity to have that threshold. And I think that that's an awesome opportunity for docs to have great conversations with coaches, with managers, with trainers, with parents, with cousins, brothers, uncles, whoever it might be, of those athletes, depending upon whether they're a student athlete or whether they're a semi-pro or they're a full professional athlete, being able to, there's not many things that can literally improve the threshold of performance, right? And when you have great sensory motor integration, you've improved the threshold. Now you got to still do the work to maximize that. But that's what I guess the athlete fired up. They want to do the work to maximize it. It's when you're hitting that brick wall. And, I think about a sneaking suspicion in my mind right now, like, man, I'd love to do these tests on every pro and see which ones are feeling like, I'm hitting a brick wall. And there might be some good reasons for that.
Yeah, for sure.
Yeah, that's awesome.
Absolutely. So just to show you, this is, again, you're pretty neurotypical. I mean, you're around the average, right? But let's see how an actual patient looks like. Post, this example is post-concussion, but look at that.
Yeah, that's stark in terms of highlighting the dysfunction, especially compared to what we just saw. So it looks like, a noodle, of a baby drawing.
It is
to that effect. And I can imagine that has some cognitive challenges.
Absolutely. Yeah. And this is an 18-year-old athlete that suffered 2 concussions within a short period of time.
Right.
But we can see it.
Right.
And that's what has been impossible until now, is to actually, how can we objectively document this.
Yeah. And I'll dig deeper on that for a moment, because I think it's, one of the things that I've always thought of is, and I think everybody out there listening has heard, is one of the biggest opportunities in chiropractic is with neuro and brain health, right? And often we tie that back to concussive symptoms, whether athlete or motor vehicle accident. And one of the challenges I've always had internally is, like, how do I test for that? Like, how do I really get fast information that's accurate? And to me, this showcases a lane and an avenue to be able to get the data necessary to be able to, if you have implemented concussion care in your practice and you're not doing this, you're probably missing out on a massive opportunity. If you've been thinking about adding concussive-based care into your practice, and like me, it's like, well, how do I do that? Like, I know what I'm going to do with my care. I know how to take care of people, but how do I describe this thing that, people may know they have a concussion, but how do I show that? And being able to show this can absolutely take that patient that one step from, I know I have this issue, to, I believe I'm in the right place to get help. And being able to set a baseline, if you can't do that, you're up a creek, right? So being able to set a baseline and then show that improvement, I love it.
Also, from a marketing perspective, I know that's, your forte. What we help our customers do is, obviously, how can you leverage, our technology to differentiate yourself? And many are starting up a new program, going out to the schools or going out to the teams, marketing themselves in their environment, in their market. Hey, we have cutting edge technology, something that hasn't been available before, backed with 20 years of research and reliability to provide you and with the best possible care that's out there.
The ability to take something like this, and I know many docs out there have back in the day, chiropractors used to do a lot of spinal screenings, and a lot of docs go on location now and do taping and things like that. And that's great, but we all know that when you bring out a piece of technology, you get the ooh and ah factor, and people like that. So if you are a doc that's been going out to local events, so we talked about it on the sidelines or in the locker room, but if you're going out to local events, talk about an opportunity to be able to bring technology that's got to get people's attention, get objective data that's real, and then be able to open up that conversation in a meaningful way. Like we said, this does not take 25 minutes of explanation. By the time the report is generated, you're going to have the patient telling you what's wrong with them just by being able to see it. So to me, any doc that's out there doing events, and again, maybe you're doing taping, maybe you're doing spinal screenings, maybe you're tired of that, or you're like, man, I wish I had something else to bring to the table to get attention at this expo.
Absolutely.
This is a great opportunity to do so.
Really is. And also, I think, just where we are headed, as individuals, as society, people are seeking knowledge, right? More and more and more. The patients are becoming more and more educated as well. Everyone has diagnosed themselves before they go to the doctor, right? So to be able to provide that objective documentation with a report that people can also say, now I understand that. And they connected with their pain, like you said. Right. They connect the dots in a way better way, and buy into your care in a completely different way and on a different level.
Couldn't agree more. Yeah, it's fantastic. It's fantastic.
Thank you so much for watching this video on the Evidence-Based Chiropractor channel. If you don't want to miss a single thing, please subscribe to our YouTube channel so you can get notifications of every video we put out, and we put out new content each and every week. So be sure to subscribe today.